This year, we are celebrating 15 years of the ACCC Innovator Awards. This program has had a profound impact on cancer programs across the country, changing the way cancer care teams practice and improving cancer care delivery in the U.S. Under the leadership of ACCC President Una Hopkins, additional educational programming is being done to address the growing cancer patient population to ensure that every patient, no matter who they are or where they live, has reliable access to high-quality cancer care. All of the program members being recognized today for their innovation in care delivery support this important initiative as well in one of 4 key areas. This year's ACCC Innovator Award winners are helping to design oncology care to meet the needs of a growing patient population by using technology as a workforce multiplier.
During the development process of our ePro, the teams from Canopy and Highlands worked closely together to create a robust tracking and symptom acuity system. This system has enhanced our ability to monitor patients while at home, effectively preventing missed or underreported symptoms. These issues are now consistently tracked and recorded by the app by prompting patients to report during expected lab nadir and times of increased symptom burden based on their treatment. This has allowed Highlands to better support our patients in a more efficient and timely manner, thus decreasing our need for preventable, symptom-related hospitalizations and increasing treatment adherence.
We landed on a great technology, and then we started intentionally putting that program into all of our hospitals.
I vividly remember the first discussion that we had about this little company called Eon. And I remember discussing the potential impact that this technology could have. That of the thousands of scans that are happening inside of our organization, to take that scan, move it over to the side, and search for something that the physician may not even be looking for initially. And then to be able to reroute that back to the patient through their primary care provider to identify something that needs to be taken care of.
This year's ACCC Innovator Award winners are helping to design oncology care to meet the needs of a growing patient population by optimizing oncology service line structures.
Using staff input, we conducted voice of the customer focus groups to identify critical to quality measures and value. We then applied the Lean Six Sigma approach to identify current state.
What's great about the ambulatory care redesign is the fact that we have a very systematic method of communication between patients, providers, and for specific things. It basically enables workflows to be routed appropriately in a specific manner so that individuals know exactly where things should go and who should receive them.
It really was being able to create a tool that clinicians can use to be able to real-time understand the aging population of patients who have cancer. The dashboard, it's 50 different data points for these patients. Is this patient actively admitted in the hospital? Do they have an advanced directive? Have they completed a practical geriatric assessment recently? If you have an appointment today, everything from your appointment today will populate in the report. Although I'm not on the front lines, I'm able to hopefully release the burden on clinicians so that they are able to deliver the best care possible.
Everyone's different, everyone ages differently, everyone comes from a different background. So what we do is connect them with services that can help.
And now in response to people's emotional needs or distressors, we are able to partner them with clinical psychologists or licensed clinical social workers.
This year's ACCC Innovator Award winners are helping to design oncology care to meet the needs of a growing patient population by using new tools to empower and enable their workforce.
And that is why we created the Ambulatory Care Excellence Model, or ACE, to enhance efficiency, strengthen coordination, and improve outcomes, all the while ensuring our care teams are working to the top of their license.
We standardized roles and introduced care coordination as a shared responsibility across nursing teams. It has improved the workflow significantly and helped decrease stress and burnout among the nurses and the practitioners.
Our team is comprised of experts. We support each other, we encourage each other, we celebrate together.
We've made such a ripple across Penn that now these programs are expanding across the entire ecosystem. And we are hoping to open these clinics throughout Penn.
The Shaw at Home program has also had an impact on our staff. I've been able to witness a renewed sense of purpose, a new sense of inspiration, and a renewed sense of care that our staff have been able to give to so many.
This year's ACCC Innovator Award winners are helping to design oncology care to meet the needs of a growing patient population by finding new ways to build capacity at scale.
The ACE model additionally introduced benchmarking tools to adjust staffing based on clinic volume, ensuring equity, sustainability, and a smarter allocation of resources.
Before the redesign, we lacked a clear process to support staffing decisions. We are now able to calculate how many staff we need utilizing a few data points. With someone available daily to manage tasks, we've seen faster turnaround on patient messages and care needs.
How can we keep a closer eye on who gets the palliative care consults in order to prioritize those people who are most in need?
Working with our really talented folks here at WellSpan, who pointed out that there was this predictive analytics score running in the background of our Epic instance. And nobody was yet using it. It's called the End-of-Life Care Index. So it's a predictive one-year mortality score.
It looks at patients' comorbidities, their age, the condition that they're in at the moment there, and it gives it a score.
Anything over 45 is considered high risk of predicted mortality in the next year. So that's where we started. We've gone from a system who minimally used palliative care with advanced stage cancer to, over time, organically growing those referrals 84%.
That changes the conversations we have, that changes how aggressive we are in managing symptoms. The benefits are now proven, not just again to the patients, but to the dollars and cents in healthcare savings for everyone involved.
The SHA at Home program would not be possible without the support of our community members. To see this program come forward as an idea, a realization of an unmet need for our patients, take it through to a campaign, to an assessment, and then launching a robust, successful program, I will say has been one of the great highlights of my career.